You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking to Oregon's go-to implant dentist, Dr. Blake Drew. Dr. Drew, welcome to the program.
Thank you. Happy to be here.
Okay, now I know you brought a stack of photos, so we'll get to as many of those as possible. But for people that don't know your practice, like who's the typical dental implant patient?
So we don't necessarily have a typical patient, but the two types of patients that come to see me for dental implants, you fall into one of two categories. The first are patients that have teeth and they're headed towards a denture, and they are in pain. They have bleeding gums, they have infected gums, they have bad breath, they're having trouble eating the foods they want to eat, they're embarrassed about their teeth. So that's the first type of patients who usually come to see me. They know where things are leading to, they know they're heading towards a denture, and they're coming to me to see what are my options, what can I do to not be heading towards this future of a denture. So those patients, if we've determined that their teeth are not savable, that they're not teeth we're going to be able to work with, those patients, we're able to give them a whole new upper and lower set of teeth on dental implants.
That don't come out?
Don't come out.
Okay.
They're fixed.
What's the second group?
So the second group is a group that usually doesn't come to see us at the dental office. They are patients that are already in a denture. So they've either been wearing a denture for years and they've accommodated, they're used to putting up with really what in my opinion is not a great solution. And they usually are patients that have gone through a lot of headaches to get to the point where they're at with having a denture, and they're just not interested in going back to see the dentist. So we don't see them.
Do you still hear that, by the way? Like, no offense, doctor, but I don't like the dentist?
Oh, absolutely. These are patients too, Randy, that they've gone through, they've run a labyrinth with the dentist. For years, they've gone through pain, they've had fillings, they've had root canals, they've had bridges, and they've usually had them fail for a myriad of reasons. But at the end of the day, they're just sick and tired of going to the dentist. So they want a different solution. And with those patients, we're able to give them an upper and lower set of teeth that don't come out.
Okay, so tell me if this is true. I mean, on the day of the procedure, a denture wearer could literally walk in with no upper and lower teeth and walk out that same day with upper and lower teeth that don't come out that you printed in the other room.
Absolutely. So
that happens.
You bet. Yeah, it happens all the time in our practice. And the main reason for that is that we have invested heavily in having the equipment to allow us to do that. So we'll have patients.
You have a machine that actually makes the teeth.
We have a machine that actually makes teeth. We have a machine that will 3D print teeth. So it really is futuristic. A lot of patients that come in, they're blown away that we are making teeth that fit their face, that fit their mouth, and they're being printed next door in our, the next room over. So
now we jokingly talked before we started privately, where if all the denture wearers figured out how good this was, there's just not enough dentists in America to even take care of it.
Right.
Is that an exaggeration or?
No, I think that's completely fair. This procedure can help so many patients, but unfortunately, a lot of people don't take advantage of it.
Now in Oregon, when we think of it here in California, it's such a healthy place. Are there really a lot of denture wearers or people headed to dentures?
Absolutely.
And there's a lot of people.
Yeah, I mean, statistically, Randy, there are tens of millions of patients in the United States that have an upper or lower denture, and also tens of millions of patients that are missing more than 9 teeth. So there is absolutely a population out there, but again, there's a number of reasons that patients don't want to come in and even know what their options are, unfortunately.
So why is it? I mean, if it's so good to get new teeth now, tooth replacement with dental implants, why aren't they all doing it? Like, what's your take? You've already mentioned that a lot of these people don't go to the dentist anymore. Maybe they're fear of the dentist. What are other reasons?
Some of the other big reasons, one is fear of pain. Patients are really worried this is going to hurt.
It does seem painful.
They're numbed up. Is the best part about it. So patients are not feeling this because of the anesthetic or the numbing that we're giving. But on top of that, we can offer a lot of other options to make it that much easier. So we can do oral sedation. We offer IV sedation for patients that basically allows them to essentially take a nap, sleep through the procedure. And the best part with sedation is that patients don't remember what they went through. They come
Is
away
that
with
right?
very little memory of the procedure at all, and very little pain. So there are a lot of things we can do to overcome.
So they
that
just
word
get a
of pain.
ride home after the procedure.
They get a ride home, they'll get a ride to the procedure, they'll get a ride home afterwards. And most patients that we see with this procedure, they're on over-the-counter Tylenol, Advil. So they're not on heavy pain medications after the procedure. So back to your original question, another reason patients don't want to go through this procedure is they think they're too old. So
How old can you be? Like at the upper range?
There is no upper range. We have patients in their 80s, their 90s that have gone through this procedure, and it's been wonderful for them. So
What's your oldest patient?
83 years old.
83. Why would an 83-year-old want to do this?
They want to do it because they want to eat. They want to chew the foods that they enjoy. They want to be able to smile. They still want to enjoy life. So that's really, especially as patients in that age demographic, we found that food is really a big part of their life. They're going out with friends. That's a big social component for them is eating, and getting a new set of teeth on implants that they can feel comfortable eating those foods is exactly what they want. They want at this point.
Is this one of those things that when it's all done, they go, I should have done this a long time ago?
Absolutely. I mean, and that's a hard part. I have done this for patients. We've done this procedure for patients that are in their 70s and 80s. And if we'd had a chance to meet them 15, 20 years ago, they'd have had this that much earlier. And the technology has absolutely come a long ways, but yeah, I wish we could have done this for these patients years ago.
I guess there's two types of dental implant programs for people that have to have all their teeth removed or they're wearing a denture, is snap in, snap out teeth. And then there's the full arch of teeth that don't come out. Sounds like everybody wants that, but I guess it's a little more expensive.
It is. It is a little bit more expensive, and it can be, but we see both types of patients. And I have for years now treated patients with a snap in, snap out type of denture because years ago it was more commonplace. We didn't have the technology, and we didn't have the ability in these streamlined digital procedures to do this. So it's been rewarding to have those patients that started with the snap in, snap out denture be able to convert to doing a new set of teeth that are completely on implants that don't come in or out. And
so you've done a lot of these snap ins. What if one of the patients is watching this?
Yeah.
So they can be converted over to upper and lower teeth that don't come out.
Yep, absolutely. And it's a relatively easy conversion. We know that implants are going to be successful in these patients. They've worked to help stabilize the denture. So just simply adding, in some cases, just a couple more implants or a few more implants, we're able to give them teeth that don't come out. They're completely stable, and they're essentially their new set of teeth.
Now we have to mention, I guess, even the best dental insurance doesn't cover this procedure, only a small portion. Medicare, Medicaid doesn't really cover this.
Yeah, but Randy, we have patients every day that we're utilizing financing. So in our practice, I'd say roughly 50-60% of our patients finance all or some portion of this treatment. And when I talk to my colleagues around the country, it's the same thing. A large majority, some areas, 70% of the patients are financing this treatment because there are the options out there. There are lenders that specifically focus on lending for this type of procedure.
You have to have okay credit a little bit.
You have to have okay credit, and we have, fortunately in our practice, we have front office team does this day in, day out. They have these discussions with patients to figure out what type of lending, what type of financing is going to work best for them.
But what if you have bad gums, like gum disease, periodontal disease? Can you still do this? Are the gums good enough to hold an implant?
Absolutely. So once we clean those, those are gum infections, and we can treat those. We can literally cure those infections. And once we are able to get rid of the teeth and the infection in the tissue that's causing those issues, patients are great candidates. We get that bone healthy, the tissue's healthy and pink, and we're absolutely able to still offer those patients new sets of new teeth on implants.
Now, 70+ crowd, a lot of 50+, 40+, but for the 70-year-old, statistically on 4 medications, can you work with people on things like type 2 diabetes medications or even blood thinners?
Of course, we every patient, when a patient comes into our practice, that's the first thing we do is we have this discussion of we get a chance to meet the patient, and we understand what their medical conditions are. We understand what their medications they're taking. So a lot of times working with their physician, we're able to modify medications if need be. What's interesting is by giving patients healthy, stable teeth on implants, a lot of times we're able to have them come off of some of these medications. They're able to eat a healthier
right? Okay.
diet. They're able to live a healthier life that a lot of times can help minimize or eliminate the need for these medications. So
So you brought some photos. What are we
I
looking
did
at?
indeed. So take a look at this first one, Randy. This
right.
is a patient of mine, Joel. So Joel was interesting. His wife had been a patient of mine for several years. So she, wonderful, wonderful lady. And as we were treating her, she continued to mention her husband that had bad teeth. He was embarrassed of his smile and typical for most men, he finally agreed to come in when he was having a lot of pain. That was sort of the threshold to get him in. So Joel is in a situation where if one of his options, a lot of practices would have just given him a denture. His option would have been to have, absolutely, his upper teeth would have all come out. He would have had a denture, had a plate that would have been his only solution. It would have just driven him crazy for years to come. So, so what we were able to discuss with Joel and create a plan for him was to remove his upper teeth, his infected, painful teeth on the top, and we're able to do implants for him. The same time we did his extractions, and we're able to get him into a beautiful set of teeth that are completely supported by implants. So this is after we were able to give Joel.
Looks good.
So you can take a look, Randy. I mean, you can see just from those images side by side, he looks younger. He looks happier. I think even Joel would admit in those first pictures, he just didn't look happy. He didn't seem happy. He just wasn't smiling. And now he looks like someone who's successful, someone who's really enjoying their life and enjoying their smile. And Joel loves to travel. Quick side note, this is a great story. My office manager was traveling for a course and going through the Denver airport, and out of nowhere, Joel actually came up to her. This is after he had his new teeth put in. Came up to her, gave her a big hug, and was beaming ear to ear. And this was the same guy who, months before, we really couldn't even get to smile in the office. So
now his wife. Yes. She was the one that forced him to come in.
She did. She was able to.
What'd she say when it was all done?
She said it's been the best thing he's done. That it has really changed his willingness to go out, his willingness to travel, his willingness to really change his personality. It hasn't changed him. He's always been Joel, but this has helped him, I think, just really smile and become the person that's always been inside there. So.
What's it like when they look at their like somebody like this when they look at their face for the first time with their new teeth?
It's really life-changing. It's fun to see because a lot of times they're surprised. They know all along what's coming. They've seen other examples. They've seen the transformation of other patients, but for them to experience it themselves, it's the most rewarding thing that we do in our office for sure.
Do they ever get choked up?
Absolutely.
Do you see tears?
Yeah, we get grown men that cry. We get patients hugging us and thanking us. And again, these are things that just don't happen with most of the kind of more basic dentistry we do in our office. This is something that patients really appreciate. So Joel specifically didn't tell me this, but I have a feeling, Randy, that because so many patients tell me this, that they wish they would have done it earlier. And Joel's still a young guy. He's got, hopefully a lot of years to enjoy this teeth and smile, but I think like a lot of patients, he wishes he would have done it earlier. He would have
especially men, right? We wait until we're in so much pain, we finally have to go to the dentist.
Yes, till you have to go, you're in pain, or your wife makes you go. Those are
Is it more women than men than women? What is it?
It's both. It's both men and women. I would say, across the board, it's pretty even. There can be different reasons why a female may come in versus a male, but it takes all kinds.
What do they like more, their smile or the foods that they could eat?
It's a great question. It really will vary. I think sometimes patients will come in. A lot of times patients will come in and their main concern will be their smile. They're embarrassed of how it looks. They've had other loved ones or friends make comments about how it looks. But to a person, it's funny, after they have their new teeth and they've been able to enjoy them and get used to them, a lot of times they'll point out that their favorite thing is the foods they're able to eat now, the confidence they have. They're able to truly enjoy food that they didn't even think about because their main goal was just to look better, to have better looking teeth. And the opposite is true too. We'll have patients that will come in, and usually it is the men that come in and they claim they don't care about the looks. They're not concerned with the end result as far as appearance. They just want to be able to eat. They just want to be able to enjoy specific foods. They want to eat steaks. They want to bite into chewy bread or pastas, and that's their focus when they come in. But after they've had a chance to really enjoy their smile and see the changes, sometimes they'll come in and ask, can we get them a little bit whiter?
Is that
Can we
right?
get them a little bit bigger? They'll really hone in on the aesthetics because it's something they enjoy. It's opened up a new, a new aspect to their life. With if they're single, they may be starting to date now. They're getting comments about their teeth and their smile. So
they
it
get
works both
compliments.
ways. Oh, absolutely. Yeah, absolutely. We have patients that. I think we'll create Instagram and Facebook monsters. We get patients that are we can't
Like
keep them
selfies.
from posting selfies.
Are there that
Absolutely.
many people just don't even know this exists? Is that right or no?
I think so. I think that is a big issue. Patients, they may know it exists, but they're confused. There's a lot of misinformation about the cost of the procedure, whether or not you're a candidate for the procedure. If you've been wearing dentures for too long, or your
But
teeth
that's
are too
true,
far
isn't
gone.
it? I mean, if you've been wearing a denture for 20 years, you can't do this. You don't have enough
No,
bone.
not at all, Randy. That is not the case.
Is that right?
In some offices, that may be the case. In our office, we have the ability to use a lot of different options. We can use short implants. We can use longer implants. We can use bone grafting when we need to in certain patients. So patients that maybe have been told they're not a candidate, or years ago they were told that they weren't a candidate and they've just had that in their mind, that's not the case anymore.
Okay.
We treat patients all the time on second opinions or third opinions that have just been told over and over that they're not a good candidate.
So you plan these on the computer?
Absolutely.
Is that right? Like
Absolutely.
you're kind of doing it surgically on the computer?
Mm-hmm. We do. So really, what I focus on is really reverse engineering, getting the patients to see and to visualize what their smile, what their bite, their ability to chew, what that's going to look like when it's all said and done. And then we reverse engineer that. We then figure out where the teeth need to fit in their face and where these implants need to go to support that smile and support the way that their teeth are gonna bite and chew. So we can control all that digitally now with the technology we have and the ability to print in our office. We can print them new sets of teeth.
So you're making the teeth in the other room?
We're making them in the other room. And sometimes we're making them multiple sets. We'll make them prototypes. So we'll have patients that we can print, if they think they might like the teeth a little bit bigger, a little bit whiter once they're actually in their mouth, we have the ability to make some small changes and reprint them in a matter of minutes in the next room. So it's a really neat technology. So Randy, let me show you this next patient, Jeff. So Jeff had been in an upper denture for years, and same situation where he was just basically satisfied that that's how things were going to be until his denture started breaking, and he did some home repairs on it. He was he was using super glue to keep it together. He'd had multiple relines. He had just a horrible looking denture, but it's what he was used to. It's what he thought he could do. So Jeff had actually come to me. He lives about 2.5 hours away from Bend, from where our office is. And he had really done his research. He had been up to Portland. He'd been to some bigger cities, to some offices that just specialize in taking all your teeth out and putting in implants. So his big concern, though, was that he was concerned about the follow-up care. He was concerned about having quality work done, expertise work done with someone that was really listening to what he needed versus what the office was good at. So he had come to us for a second opinion, and we decided that we did need to take out his teeth, that he had teeth that were not savable. He had a lot of infection and disease and loose teeth. So what we ended up doing with Jeff is we were able to give him upper and lower teeth supported by implants.
That looks good.
It looks fantastic.
It looks natural, I should say.
It looks
Going
natural.
into this, I feel like I could spot fake teeth walking down the street. But I mean, this is because of the computer imaging,
exactly
the digital
teeth,
workflow, as you call it.
The teeth fit his face in this digital workflow. They fit all of our patients' face. We're able to, again, plan where these teeth need to go so they don't look fake. They look natural. They're meant to fit in the patient's face. They fit great in Jeff's face. He looks significantly younger. He looks happier. He's got a fuller smile that he's extremely happy with.
So people travel great distances to do this.
Right. So, right around our office.
Like, what do you serve? Like, what areas do you serve?
So, primarily we're in Bend. So our office being located in Bend, we serve, a population of around 150,000 there. But to outlying areas, we have patients that come from Redmond, that come from Prineville, that come from the Dalles, that come from Eugene. So there are a lot of, really within, hundreds of miles, we have patients that will come and have this procedure done. So in large part because of how efficient we can be with the technology, we're able to do this and finish this procedure quickly. It doesn't take months to get a patient to the point that they have their new teeth. We're
completely out of time, but we have about 2 minutes left.
Okay.
For patients watching this, let's say it's been determined all their teeth have to be removed or they're currently wearing a denture. What are their implant options?
So this is the cool part, Randy. We have several options for patients in this situation. So one option is to have a couple implants, usually 2 on the top, 2 on the bottom. They have a denture that will snap in and snap out, so it is something they have to remove. A lot of times after eating or at night, they'll have to take them out. So that's the first option. The option that most patients really want to get to, and where we see the best changes, is when we have a completely new set of teeth that are fixed, that do not come off of implants. So the implants support the teeth.
So they don't come out.
They don't come out. They don't come out at all.
How do you maintain them? They just every 6 months go to the dentist?
That's it. They come in every 6 months. We do a lot of work with a patient once we do a really good design that allows them to keep it clean. That's an important part, that they're able with their home care to ideally we like patients to use a water pick and teach them some basics, but they're coming in every 6 months. They're coming in and the best part is they're not getting cavities. They're not having issues that they used to have when the whole reason they were in this situation in the first place. So we're able to fix all those issues.
Now you say people that go through this, they tell you that they felt judged with their bad teeth.
Absolutely.
Expand on that.
So it's these patients are reporting what we know to be true in studies, is that these patients, your smile has a lot to do with how you are judged by others. So think of the movies, for example, Randy. If you have someone in a movie, a villain, someone that's poor, the director gives them crummy teeth. They've got ugly black teeth or missing teeth.
That's a good point. Good.
So those are, unfortunately it does. People determine or will make determinations of how much money you have or how intelligent you are based on their teeth. And, for right or wrong, that's the reality that a lot of these patients are dealing with.
So that goes away.
It goes away. We are able to give them a new start. And a lot of times they're just able to really be the person they've always been. They just have teeth that represent that now. So another thing that I have to mention, Randy, is a lot of times these patients are judged on their mood, that they're grumpy people, that they're depressed, that they're not fun to be around. And the reality is they just don't want to smile. I wouldn't want to smile if we had bad teeth, if we had teeth that we were embarrassed about.
Do you ever read somebody wrong, like think the guy's a big tough guy or serious person?
Absolutely.
And then they get their new teeth.
And they get their new teeth, and it's you can't stop them from smiling. So, and there's a lot of research now too, Randy, that's really, I think the biggest change is how much smiling affects our mental health. The benefit of patients smiling and the ability to release these neurotransmitters that just make us happier. So there's a lot to do with mental health, just the ability to smile. So
what are the frequently asked questions about sedation? And I guess you offer what levels of sedation?
We offer all levels of sedation. So every patient that's coming in and having this procedure is numb. They're going to be numb. They're not going to feel it. They're going to be. We use dental anesthetic to numb them up. But beyond that, what really helps with the fear side of it is either oral sedation, which is where we're going to give the patient some oral medication just to help them relax. We usually use that in combination with some nitrous oxide. It basically just takes the edge off. And I tell patients, they're at the appointment, they know where they are, but they just don't care. It just takes that edge off. And that works fantastic for a lot of patients. Extremely safe. Patients have a really easy time doing that level of sedation. And best benefit for a lot of patients is they don't remember the procedure afterwards. There's a nice bit of amnesia after the procedure from that medication. Beyond that, patients, a lot of patients will choose to use IV sedation, which is extremely safe. There's actually some studies out there that IV sedation is safer than doing no sedation because of how relaxed you're able to keep the patient. And
do you monitor their vitals?
Absolutely, Randy. So we're monitoring their blood oxygen level, their heart rate. Usually have them hooked up to an EKG to measure all of these vital signs. So it's extremely safe. And again, that same idea, it just allows the patient to be, they're not put under, that's not general sedation, but they're just extremely relaxed. They're extremely comfortable. And again, they don't have recollection of the procedure. They're still numb, so they're not going to feel any part of this, but the sedation just really takes away any apprehension and fear for the appointment.
And they lose track of time.
Oh, they absolutely lose track of time. Yeah, most patients will come in. We'll see them for their post-op appointment after their surgery. They'll say they kind of remember showing up at the appointment, but that's it. The next thing they remember, they're at home and comfortable and they're relaxing. So,
for patients watching this, let's say it's been determined all of their teeth have to be removed or they're currently wearing a denture. What are their implant options?
So this is the cool part, Randy. We have several options for patients in this situation. So one option is to have a couple implants, usually 2 on the top, 2 on the bottom. They have a denture that will snap in and snap out. So it is something they have to remove. A lot of times after eating or at night, they'll have to take them out. So that's the first option. The option that most patients really, really want to get to and where we see the best changes is when we have a completely new set of teeth that are fixed, that do not come off of implants. So the implants support the teeth.
So they don't come out.
They don't come out.
When you're with a patient and you told me that sometimes they give you their hard luck story, their dental problems. But do you ever think they have no idea how good this is going to be?
Yeah.
Like you get excited.
Absolutely. That's the best part, is knowing what they're going to look like, what they're going to feel like when we get to that end result. It's a lot of fun, and knowing, having the experience and the expertise of doing this. And
do you ever see it and go, boy, this is going to be a home run?
Oh, absolutely.
This is going to be so much better than they thought.
Yep. No, patients, you really are. The patients really don't have an idea. I think they see it in other patients, they see testimonials, they'll see other stories, but knowing for them as individuals, the difference it's going to make is really cool. It makes a big difference.
Final message. Okay, you talked about 2 groups of people, the denture wearers, which are almost impossible. I'm paraphrasing you, but it's hard to get them in. Or the person that has the bleeding gums and the bad breath they have bad teeth and they don't want to end up in a denture. Let's say they've heard what you have to say, but they're still skeptical or afraid or whatever. What do you say to them?
I say start at the beginning. Give us a phone call. Come and meet us. Let us get to know, meet you where you were at. Let us see what your issues are, what your concerns are, and let us talk to you about the solutions that we can provide for you, the things that we can do to eliminate your worries and your fears, and really get you in teeth that you're going to be happy with and make you smile.
And I think you told me that the patients will say that you changed their life,
right?
But they changed their life.
The patients are the ones that make that decision. They're the ones that they pick up the phone, they get off the couch, they come and do this, and they're making the changes. We're just along for the ride.
Okay, good. So what do you prefer? If they want to make an appointment, go to your website, make an appointment there, or contact your office? Either
one works fine, Randy. We prefer a call. It's a little easier to start the process. We'd be happy to do a free consultation to get to talk to you and meet you and see what solutions we have to get you the teeth that you want and the bite and the smile that are going to make things that much better for you.
So no more dentures. You think this is the future of dentistry 20 or 50 years from now? No more dentures?
Absolutely.
They'll all be attached to something, you think?
Absolutely. They'll be a thing of the past. So we're finally getting there.
Okay, good. And they get to meet you on the consultation?
Absolutely. Yep. Okay, they'll get to meet me, and we'll figure out some options.
All right, Dr. Drew, thank you very much. Thanks for coming on the program. Good stuff.
Thanks for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.